I think sometimes chiropractors aren't recommended by doctors because there's a misconception that we're dangerous, and that's very sad. And especially when it is a pregnant woman, you want to be very, very careful with a pregnancy. And we are very, very, very careful with a pregnancy, with pregnant women, because we respect what's going on in that body. So I think sometimes they don't recommend because they think we're dangerous. So it's a misunderstanding. I think sometimes they don't recommend because they don't know. Like, a lot of people don't know, and that's not, when you think about chiropractic, you don't think, oh, I'm gonna go to a chiropractor so I can deliver my baby. Like, that's not, those don't necessarily click together, but it would be great if they did. It would be great if we can change that concept and make it so that, all women are getting adjusted during pregnancy, because just allowing the nerves to the uterus to work better, and just allowing the circulation to be able to go through the uterus better, that is so important, and it could really impact that pregnancy in a really positive way. For pregnant women, there's the International Chiropractic Pediatrics Association, which certifies chiropractors to adjust pregnant women and adjust infants. And so if you were looking as a pregnant woman or as a mother trying to get your child adjusted, you would probably want to go to icpaforkids.org and get a chiropractor from there, because they'll have a lot of knowledge and a lot of experience, and will have done a lot of extra hours after school to understand how to very safely and very lovingly adjust kids and pregnant women. You can take an infant to the chiropractor. Again, I would definitely recommend taking an infant to an ICPA certified chiropractor, so icpaforkids.org, because they've gone through special training to make sure that they're able to adjust an infant very safely. It's very safe for infants to be adjusted. I have an infant. Well, she's 13 months at this point, so she's a toddler, but she's been adjusted throughout her infancy. Reasons to take an infant to the chiropractor. Perhaps if they're not nursing really well, if they're not sleeping really well, if they're colicky, all of those are symptoms that can potentially be helped by having a chiropractic adjustment. Sometimes an infant, if they only want to nurse on one side, it's because they're having a problem turning their neck. So they don't want to turn their neck this way to nurse. They only want to turn their neck this way to nurse. So a mom might notice that, okay, my baby only wants to nurse on that side, and why is that? That would be a really good time to take that child to a chiropractor and see if there's something going on in the upper spine.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.